Hi, my name is John Blevins, and I'm on the department on the faculty in the Department of Global Health. And it is my distinct honor to introduce to you our speaker for today, Annie Hardison-Moody. I first knew of Annie while I was still a doctoral student here at Emory. A good friend on the faculty at the University of North Carolina at Chapel Hill in the Religious Studies program there told me about an undergraduate in his classes who had impressed him both with her scholarly skills and knowledge and the questions she asked in class, and with how she was making decisions around kind of professional career and trajectory. He was referring to Annie. In 2006, I started teaching after getting my doctoral degree at the School of Theology here at Emory, and I met Annie when she came for an interview for a PhD application for her PhD program in the Religious Studies program, the Graduate Division of Religion here. And I met with her as she was applying and in her interview weekend. To Emory's great fortune, she accepted that position and began PhD studies here, and I had the good fortune to work with her as part of the Religion and Public Health Collaborative here at Emory in a variety of ways while she was a student and I was new on the faculty, first at Candler and then later here. And I watched her come into her own in academic meetings in places such as the American Academy of Religion and the Society for Pastoral Theology. I worked with her to introduce health asset mapping workshops in rural Eastern North Carolina using a model that the Interfaith Health Program had developed in collaboration with colleagues from Sub-Saharan Africa. And then later in her doctoral studies, Annie traveled with me to Kenya, and we had the fortune to work with local communities in a series of informal settlements around Nairobi to understand the local health assets of those communities. We stayed in touch off and on at various levels in more than 10 years. She left Emory and has relocated back to North Carolina. And in one of those instances where we were closer in touch, actually after a webinar that the Religion and Public Health Collaborative here at Emory hosted, Annie spoke with me about the possibility of conducting her sabbatical leave here at Emory and at Rollins in this spring 2024 semester. And I jumped at the chance for that. Talked with Usha about inviting Annie here and hosting her while she was on campus. And Usha was quite gracious in extending that invitation. So in this semester, Annie has co-taught a graduate level seminar with me on religion and HIV. She has worked with me and colleagues from here in the School of Public Health and from the Morehouse School of Medicine on a community health initiative training local health ministers and health advisors in congregations around Metro Atlanta and in rural Georgia on developing health ministries in their congregations. She helped my colleagues in social behavioral sciences at CHAMPS, the Child Health and Mortality Prevention Surveillance Program. She worked with us to help develop a 5-country qualitative study with CHAMPS to understand women's beliefs and practices related to pregnancy and delivery, and the extent to which those practices and beliefs align with or are in tension with antenatal care and obstetric care in clinical settings. Annie is a colleague in research, scholarship, and teaching and practice at the intersection of religion and public health. She is also a friend. And so today it is my privilege and delight to introduce her to you, Annie Hardison-Moody.
What's so lovely? So thank you all for being here. And thank you, John. That was just a really lovely introduction. And I cannot say enough about your mentorship and support just over these years, long years, many years that we've known each other. And it's been really wonderful getting to be here at Emory. I was just talking earlier before this about one of the things that has been kind of most restorative to me is just being on and around campus and being able to be back in this place that has meant a lot to me. And I've done a lot of running, and when I've done a lot of running, I've done a lot of thinking, and this paper is actually kind of coming out of some of the thinking and having that thinking time during scholarly leave that I've really needed. So I want to tell you all about kind of where we're going. I'm going to talk a little bit about how I got here and the work that I do. I'm going to talk about rural engagement, particularly in the US. I'm going to share the data from this talk comes from a study called Voices into Action, the Family's Food and Health Project that I have worked on since 2012. And then really I'm going to share kind of some of what we've learned from talking with mothers in rural communities about elections and their feelings about elected officials, particularly as it relates to food policy and food assistance. So to begin with, a little bit about me. As John mentioned, I did study religion and public health here at Emory. And now I'm at North Carolina State University, which I'm hoping, thanks to our Final Four appearances this year, that people understand that we're not UNC, even though I am a proud Tar Heel and UNC grad. I work at NC State, which is one of our 2 land grant institutions in North Carolina. And I knew when I was here at Emory that I wanted to do I wanted to be a different kind of academic. And I think John was one of the people who helped me to see that the possibilities for that, both within and outside of academia. I wanted to do really interdisciplinary work, the way that I was encouraged to do at Emory. And I found it hard, honestly, to find my place and to figure out where I was supposed to be. And I feel like I have found it. I work within our cooperative extension system at NC State. So I'm on the faculty in the Department of Agricultural and Human Sciences. And I also serve as an extension specialist. And so when most people think about cooperative extension, they think about agricultural extension or they think about 4-H. I work kind of adjacent to those, but I work more closely with our family and consumer science agents who collaborate with local public health departments and who are doing really interesting and innovative kind of public health related work as in terms of connecting people with access to places to be active, access to healthy foods. And I do a lot of that work. A big part of my job is working with religious communities on a program that I developed when I worked in the Division of Public Health called Faithful Families Thriving Communities. And so we work with religious communities across North Carolina. I train local health department staff, local extension agents to work with religious communities in their counties to kind of empower them to be change agents for health in their communities. And so that looks like opening up their playgrounds for shared use. This is a particularly important strategy in rural communities where there aren't a lot of access to parks and places to be active. But there are a lot of often churches or religious communities, or thinking about their food security strategies and what they're doing around food insecurity. And I also, so in addition to that kind of faith-based work, I have gotten to, over the last, since I've been at NC State since 2012, I've also gotten to work on all sorts of community engaged projects, really at these intersections of like food and physical activity that have included things like translating some of the research that we've done with Voices into Action, where seen through ethnographic time spent that we've spent in mothers and families' homes, where we've seen moms who are living in poverty not having cooking equipment, or having landlords who are not fixing things like ovens and stoves, and so they're having to like figure things out or cook in a microwave or without the equipment that they need. And so we worked with an extension agent in one of our rural counties to create a cooking equipment lending library in one of the food pantries to loan out cooking equipment, and then eventually to give that cooking equipment to people who needed it. And also one of the more interesting things, or things that I never thought I would do when I was here at Emory, I served as a committee member and lead author for Edgecombe County. The picture at the bottom is from Edgecombe County in North Carolina, for their 10-year park and recreation comprehensive plan, which is not anything that I thought that I would do, but I absolutely love it. The picture down below in Edgecombe County is of a park in Whitakers that my friend Yvonne, who is where's Yvonne, kind of in the middle left of that picture. But she and I worked together for years on projects in Edgecombe County. She knows everyone there. I couldn't go anywhere. I spent a lot of time in Edgecombe County. I couldn't go anywhere in any of the tiny municipalities without people coming up to Yvonne and knowing her. But she knew folks from Whitaker's who had been just as a part of their community, like taking this abandoned school playground and rehabbing it. They're on their own, the community members in Whitaker's, very tiny town. And so we worked with Yvonne and with others in the town and the county to do things like install picnic benches because people were having family reunions out there, and to work on the playground restoration. So I've worked in a lot of rural communities. I'm from a rural community in North Carolina. I've gotten to do a lot of work in the community where I'm from, which is Harnett County, and then also in counties where my husband's family is from. So the big picture, this is from Seaboard, North Carolina, which is one of our northeastern counties. This was a walk audit and park plan and walking trail that happened in Seaboard. That's the mayor of Seaboard. She's right there in the blue shirt, and the county extension director is right next to her. And so my husband's family is from Vance County, which is kind of one of those northeastern counties. His dad still works there. So rural North Carolina matters a lot to me. I do a lot of work in rural North Carolina, and the voices and the stories that I'm going to talk about today, they really matter. And I love that I've been able to find a place where I can do this kind of gritty community work that I dreamed about doing when I was at Emory. So here I am. I want to talk a little bit about some of the issues that shape life and health in rural communities. We know that rural US Americans experience worse health outcomes than their urban counterparts, higher rates of suicide, overdose, food insecurity, and diet-related chronic diseases. And these poor health outcomes are shaped by structural inequities in rural communities, lack of grocery stores, safe places to be active, persistent poverty, lack of access to healthcare, and continued economic disinvestment in many rural areas. And since this has been over several decades, many rural communities have experienced decreases in farm and manufacturing sectors, and the closure of rural hospitals. And this has led to unemployment, underemployment, and outmigration of young people, in particular, seeking economic opportunities in bigger cities. We've seen this in North Carolina as well. Research on and with your rural communities in the US has focused predominantly on these kind of health issues and health disparities, framing these morbidity outcomes as, quote, deaths of despair. And that literature is really important. However, a lot of the framing and the work that's happened, whether it's in that kind of health equity realm or in politics related to rural Americas, has really centered the issues of white rural Americans and ignoring or not paying close attention to the diversity of rural communities. And so that's a part of what I'm gonna do with this project here. And additionally, this framing tends to look at rural communities as deficit-laden areas, even though there have been lots of studies that have shown that rural communities are nuanced, they're thriving, there are interesting and important things happening in rural communities. They possess important assets and resources that can promote health and well-being. And so given all of this kind of nuance in rural areas in the United States, there is a need for more research and particular work that's attentive to these historical, structural, and policy influences that shape people's health in rural communities across markers of race, gender, class, and place. And particularly from a policy standpoint, it's really important to understand what are the issues that are driving and important to people in rural communities to develop a more responsive public health system for people's needs, while also addressing these issues of health equity and disinvestment. And we know that the COVID-19 pandemic hasn't helped any of this, so a lot of mistrust of public health and ever evolving messages and concern. And this is rural communities and urban communities as well. But one of the things that's interesting, and I can't get into as much in this presentation because I'm focusing here on food and food access, but we heard a real plethora of responses and perspectives of people in rural communities related to the pandemic and the pandemic response at state, local, and national levels. And so as we think about rebuilding trust, particularly in rural communities and public health, there needs to be careful attention to that, and not just painting communities as if there's a lot of mistrust of public health and kind of in this kind of antagonistic way. For example, we heard a lot of moms in our study, including mothers who politically, based on who they told us they voted for in 2016 and who they plan to vote for in 2020, I would have expected to hear lots of concerns about things like mask mandates and stay home orders and things like that. But a lot of the participants in our project said they wish that the state and the federal government had done more to shut things down, and that they felt like their community wasn't doing all that it could to enforce things like mask mandates. So fascinating, like really interesting and really important things that I can't get into in this paper, but it's nuanced. And in our increasingly fractured and polarizing political environment, it's really important to understand how people are navigating these political contexts and how they shape their life. And so that's what I'm working on with this particular paper, is to understand how mothers in particular, and I'll talk about why mothers are important, mothers and grandmothers, to look at how mothers and caregivers in rural communities, particularly mothers who are living in poverty, are talking about and thinking about food and health policy implications of their lives. And so we looked at this in 2016 and 2020, specifically focusing on what mothers in our study wanted elected officials to know and understand about their lives. And I think this helps us to get at some of that complexity and nuance, and to really center the people whose lives are at the center of public policy debates around food assistance, things like SNAP, Farm Bill, and yet who are not at the table when we're talking about food and food assistance policies. So all of this research comes out of a project that I've worked on, as I mentioned, since 2012, called Voices into Action. It was a an 8-year USDA and Russell Sage Foundation funded study of the family food environment. So between 2012 and 2020, we conducted interviews and observational research with 124 low-income rural and urban North Carolina families. And our main focus of the study, as we started out, was to think about what are the contexts and environments in which female caregivers in particularly are making choices and decisions about food. So what are the things they are thinking about? What are the access issues that they face? How do they think about cooking and food preparation? We worked particularly with women who are mostly mothers. We did have some grandmothers who had full-time care of their grandkids, who had young children between the ages of 2 and 8 at the baseline, so 2012. And we interviewed female caregivers because women still disproportionately are responsible for preparing meals in American households, and they play a key role in mitigating food insecurity, which I'll talk about in a little bit. We had a very interdisciplinary team that was made up of sociology, family science, me from religion, we also nutrition, and we conducted over the course of the study, we did semi-structured interviews in years, in 4 rounds, so 2011, 2012, 2014, 2016, and 2020. And then in years 2 and 4, we conducted ethnographic observations with 12 families in the study, and we kind of tried to be representative in the 12 families that we selected. And we spent, during those ethnographic observations, we spent about a month with those families at attending different events with them, spending time in their homes, over the course of like 10 to 12 visits that were pretty long in length. We also conducted 24-hour dietary recalls with mothers and with 1 year in children. In 2016, we also interviewed children because the kids who had been a part of the project, who were kind of we identified at the start of the study kind of like a primary focal child that we asked questions about over the course of all of the years of the study. And as we got to year 2016, those children were able to answer questions themselves and talk about their experiences themselves. We also, in addition to this, organized asset mapping workshops, which Dr. John Blevins helped us to create and trained us on how to do that. and worked on community food assessments. And based on the results of all of this, we supported local coalitions and coalition building. We funded mini grant projects in each community that prioritize the mini grants. I can talk about those forever too, but the coalitions actually developed the criteria for the mini grants. They reviewed the mini grants. They were kind of the guiding lens on that project. And several of those projects are still kind of working and going on. And we did it all in partnership with the local extension agents in each of those counties so that that work continued on. And we didn't want this to be a research project where we can come in and do this work and then leave, but it's kind of a fulfillment of our continued extension work. We did have pretty high continuation rates with moms who participated in the project. So in of the 124 who participated in year 1, 90% participated in year 3, 73 in year 5. And then we did have 54 who did the 2020 interviews, which I'll talk about in just a minute. And those were shorter. Our study sites were diverse. They were in 3 counties in North Carolina, and the poverty rates for the 2 rural regions was just under 20%. In the urban neighborhood where we were, it was twice that. So for this paper, I'm focusing on 2016 and 2020, where there was a lot of talk about elections, and we specifically in both years asked what caregivers wanted elected officials to know about their lives and to understand about their lives. And I'm looking at that kind of as change over time as well. So trying to put a longitudinal analysis. And we've kind of developed themes looking at this 2016 and 2020 data longitudinally, while also having the broader frame of like the longer relationships with the mothers and caregivers who are part of the study to be able to understand that change over time. And so here's a little bit about the demographics for the participants. And I didn't mention this before, but in this particular presentation and in the paper that I'm working on, based on this, we're focusing on the US-born mothers. We just published another paper on dietary acculturation, looking at experiences of the Latina mothers who are part of the project. And they're very different in how they think about elected officials, how they think about elections. They were all born outside of the US, mostly from Mexico and Central America. Many lacked legal documentation and are unable to vote in US elections. And particularly their experiences with immigration and those fears of deportation really shaped how they thought about food policy and how they thought about food assistance in particular. And so it's a very different conversation than the election and elected official conversations that the mothers who were Black and white were talking about. So that's where you'll see those differences in demographics. You can also see the prevalence of food insecurity in those mothers in years 5 and the rural mothers in years 5 and year 8, at about a third of the mothers who were part of the study reporting food insecurity, and we use the 10-item USDA scale. So what I want to talk about here is about the ways that a lens of motherhood was one of the key kind of lenses that mothers used and caregivers used to interpret politics and to think about their relationships with food assistance policy and also with elected officials. And it was kind of this lens that we saw of how they interpreted and perceived potential impacts of policies and program changes in terms of how they would impact their children. And so I'm going to talk about, there were some very important differences by race, with white mothers being more likely to embrace tropes of deservingness when talking about the government spending priorities and feeling disengaged from the political process, so saying that it didn't really matter to them, whereas Black mothers expressed increased feelings of anxiety and worry and were making concrete steps to mitigate those changes. So that feeling was very different from that kind of disengagement, like it doesn't impact me. So I'm going to share some of the key themes that emerged as we started analyzing this data. And I meant to mention this at the beginning. So as I said, I started thinking about this paper well, I started thinking about this paper in 2016 as we were collecting this data, 2016, and thinking about the 2016 election and wanting to write something then. We ended up, for various reasons, not working on that paper at that particular time. We were doing some other things. And then, so then we started to look at it in 2020 as well. And this project was co-led by me, and Sarah Bowen, who's in sociology at NC State, and Seneca Elliott, who was at NC State and then at the University of British Columbia. So in 2020, we decided to collect some additional data and to talk to mothers about COVID. And so we were kind of looking at these things together. Seneca passed away in 2021. And so it's taken a little while to kind of like get back and thinking about this. And it has been these like sabbatical, like long runs where I've just been like ruminating on what we learned. So that's that piece. And we brought on Lindsay Haynes-Maslow, who's my colleague. She used to be in my department, but now she's back at UNC Chapel Hill in health policy to kind of help us think about this from a policy perspective as well. And I forgot to mention Sarah and Lindsay at the beginning, but they're working on this with me. Okay, so the first theme was really that mothers felt that politicians didn't understand just how many people experience food insecurity, and they wanted them to focus more of their time and efforts to address its impact on families and children. As Kyla, who's a Black mother of 3, shared, quote, "It's no reason for children to go hungry. There's no excuse, it's no reason for children to go hungry." They wished elected officials could see and understand the realities and daily indignities of being food insecure. And they wanted elected officials to really walk in their shoes and experience what it was like to stand in line at a food pantry for hours and get rotten or expired foods, or to have to make difficult financial decisions between food and medicine, as one mother talked about. And then they felt penalized when they tried to get ahead. So for example, when mothers increased their hours and were able to get a better paying job, they were then right at the border of income limits for SNAP benefits. And those decreases in the SNAP benefits when their employment increased made it that much harder to get by. As Shauna shared, I think we need more food, just for the kids' sake. They should be more lenient with it. SNAP, like single parents should get more for their kids to feed them, especially if they're working and trying to do something more. So mothers emphasized how hard they were working to keep their children fed, and they felt that this work went really unseen by politicians and those in power. By paying attention to the experiences of poor and working class mothers, caregivers felt that government officials would be more apt to provide services that allowed them to feed their families and maintain their dignity. A second theme was kind of ease of access and universality, I would say. Throughout all 8 years of the study, in interviews and ethnographic observations, we saw mothers forming as much of a buffer as possible against their children's experiences of food insecurity. The caregivers wished elected officials could see and understand what that looked like, and they wanted, they felt stigmatized by having to seek out help, and instead they wanted elected officials to support and maintain programs that centered human dignity and that were easy to access. So Pam here, a white mother of 2, said, I'm going to shorten her quote a little bit, "A mother ought to be able to say, well, baby, if you want that, go right ahead and eat that. That's what I tell them. They need to mandate. Don't make people think they're begging for help. That's exactly what these places do. They act like you're begging them to help you. I'm sitting here begging you and you're still going to deny it. My youngin's hungry. She don't understand that I can't go to the store and get her nothing to eat." Like other mothers in this study, Pam's assertions of what a mother should be able to do for her child reflected the ways that mothers wanted to protect their children from these kinds of indignities of poverty and food insecurity. And they wanted the systems that they interacted with to promote that kind of human dignity as well, and not make people feel like they're begging for help. And the pandemic, the COVID-19 pandemic, surprisingly provided those kinds of mandates that Pam was talking about. Several pandemic-related food and economic security initiatives were applied kind of universally. Things like PEBT, the increase in SNAP benefits, stimulus funding, stimulus checks, and most mothers shared how this additional financial support helped them to catch up and pay for larger expenses that they had never been able to address before. And the ease with which people received those funds, in particular, they talked a lot about the stimulus checks, enabled them to begin to see a little bit of financial hope in their future, which is something, again, looking at this data longitudinally that we did not see in other years of the study. So Jackie, who's a white mother of one, shared with the stimulus check and along with both of our incomes, I was able to get our credit card debt under control and I was able to pay that off. And yeah, that really helped us. And Kimberly, a Black mother of one, echoed this, saying the stimulus checks allowed her to, quote, have time to think and to catch up on things that I should have done a long time ago. So I just feel like it's just a breather. This kind of immediate and accessible support didn't force mothers to beg for help. Instead, they shared how it allowed them to finally catch up on overdue bills and provided some much needed breathing room from these regular food and financial struggles. And I will say on the emergency food side, which I had not analyzing as much for this paper, but have for another project, is what we saw during the pandemic with emergency and charitable foods. Mothers and grandmothers said the same things, that they were more likely to access school meal pickups or food boxes that were available at a school, for example, because everybody was getting it. It wasn't them being singled out, but it was available and open to everyone. There weren't like barriers on who could qualify. You didn't have to wait in long lines for things. So that kind of like accessibility is really important. And also the feeling, decreasing those feelings of stigma. So this third theme is about deservingness. And this is something that we saw real differences, stark differences across race in this particular data set. So although almost all caregivers wanted elected officials to increase and improve support for food insecure families, there were key differences by race and how mothers thought these funds should be spent. Several white mothers in particular couched these reflections on public benefits and policy with a language of deservingness. They wanted politicians to focus on who they felt was deserving of public support and dollars and who was not. So for example, when reflecting on the 2016 election, Tricia, a white mother of two, noted her support for stricter immigration policies and asked, quote, why are we bringing refugees in here? We don't know them. I'm not a fan of that. And Clarissa, a white grandmother of three, shared, we've got too many illegal aliens. We have too many immigrants in here right now. We have our own people to take care of. We have homeless veterans. Deservingness was not only linked to sentiments about immigrants and immigration, but also concerns about how the US budget dollars were being spent and whether they were being spent on US families in particular. So Becky, a white mother of two children, said, quote, we can't save the world if we can't save us. We have so many families, so many kids, so many elderly that are hungry and starving and lack nutrition, but yet we're willing to fund billions of dollars to different countries to help them out when we can't even help ourselves. White mothers' concerns about whether others were deserving of public support extended within their own communities as well. So like judging and looking at other people who they felt were receiving benefits. Where several saw public benefits being used by people who, quote, don't need benefits, who can really work, just get by on what they want, while others struggle to have what they need. And during the pandemic, several white mothers who continued to work resented that others were able to obtain unemployment benefits while they had to work in hazardous conditions. And I will say the Black and Latina mothers in the study were still working as well, but they did not express these sentiments of deservingness around who was working and who was not working and who got unemployment in the ways that white mothers did. So as Miranda, a white mother of two, shared, so I kind of feel like we're being slapped in the face. We're putting ourselves out there just like the doctors, the nurses, the paramedics, and cops, and we're not seeing any extra money anywhere. But deservingness was a really complicated topic. So it definitely fell out along these lines of race, but also mothers throughout all 8 years of the study across race and ethnicity did not see themselves as deserving of public support either. So several caregivers talked about this as they were reflecting on the COVID-19 pandemic. For example, saying like, I don't need to go to a food pantry. There's other people who are worse off than me. And one mother said, there's people who can use it more. Who are more in need. It's not like our pantry's dry. And we heard those sentiments like across all 8 years of the study, across lots of different mothers. And so this idea of deservingness that has to be analyzed from that perspective of race and how we talk about and the racism inherent in how we talk about things like public nutrition support, while also understanding like mothers across the board are applying those sentiments to themselves and feeling really judged by them and feeling like you have to be in a certain position to be able to deserve support. So finally, I want to talk about how the mothers in the project really did not trust that the government was going to look out for them. And they shared how despite this, they were going to make a way and ensure their families were fed. So in both 2016, 17, and 2020, caregivers expressed anxiety about potential cuts to federal programs like SNAP that enable them to feed their children. And during interviews in 2016 and 2017, many mothers, regardless of who they voted for, so this was including people who had voted for President Trump, who was the one talking about these cuts to SNAP, they worried about their families being cut from these services that they needed. And they worried about the cuts to SNAP, even when voting for candidates who were espousing those particular cuts. And that, again, was predominantly white mothers. But not all mothers felt like the government, in particular the president, had much control over their day-to-day lives. And again, this is where there were differences between white mothers and Black mothers and how they talked about this. So in 2016 and 2017, several white mothers told us they didn't vote because they felt their vote didn't matter. And for some, this was because politicians, quote, always tell you what you want to hear, and when they get in, it's totally different from what they do, which was Kitty of White Mother of Three. Others didn't pay attention to the, quote, negativity of politics, and instead they said, I just ignore all that and go about my daily life. As Samantha, a white mother of three, shared, quote, it is what it is, and that's pretty much how I feel about it. I have no thoughts, and I'm not into politics. I mean, he, talking about President Trump, doesn't affect my life or my children's life. I mean, yeah. And a couple of white mothers thought the president, this was two in particular who said this thing, and so it was like so jarring to me, who said the president doesn't have much power, and instead is just a figurehead and someone who shakes hands with people. They felt like the Senate and the House had more control over their day-to-day life. So rather than that kind of see what happens outlook, many Black mothers in 2016 and 2017 shared that they would navigate these potential food and health policy changes by taking care of their own and drawing on prayer and faith. So again, as somebody who studies religion and public health, this is really interesting to see in 2016 and 2017 how resonant those images were, and how much these mothers in particular talked about the importance of prayer and faith in this. As Katina said, quote, I'm praying that Trump will have a change of heart, and I'm thinking that he will. Some of the things that he probably looked back and said or whatever, I'm just hoping he'll have a change of heart. And for several Black mothers, faith was a form of resistance in the face of government instability and or outright neglect. As Georgia, a mother of two, noted, this faith was also rooted in action for self, family, and community. So it wasn't, and this is how womanist theologians and thinkers talk about the concept of making a way. It's not what sometimes in public health we might describe this as fatalism, like, well, I'll just pray and it'll get okay. This is like an active kind of faith. So as Georgia said, I'm hoping it works out, and I guess we just really need to start making our own businesses and being able to take care of ourselves, because ain't nobody else gonna do it. We've got to start building up our communities ourselves, because there ain't nobody else gonna do it. We don't get it. They ain't gonna care. And caregivers across the board wanted consistency in the political responses to their problems and hope that elected officials would live up to these oaths of office. But they really worried during the pandemic about what was going to happen. And so that was a different kind of anxiety from the seeing what they talked about as confusion and chaos of 2016 and 2017 from the pandemic, where they would talk about how, well, I feel like nobody knows what's going to happen and they're doing the best they can. They kept talking about they're doing the best they can. They're doing the best they can. But they were very clear also, because we interviewed them from May to November 2020 about the COVID area policy changes that were helping their families get by or even thrive, things like PEBT, expanded SNAP benefits, the stimulus funding, but they really didn't think that the government was going to keep those going. They didn't trust that would continue. And some even worried about the repercussions down the road. Like they felt like it was going to come back and get them. One mom said, she was like, we're going to pay for it somehow. Like somehow they're going to come back and they're going to get back with us. And So in the face of this kind of uncertainty, caregivers were left to what they said, hope for the best, while doing all they could to make it work in the meantime. But yet at the same time, they were providing, as I mentioned earlier on in the presentation, this buffer for their children against food insecurity. So others talked to us about during the pandemic time about how their kids, they're home more often, and so they're eating a lot more food. Those of us who have children can remember that. And it was like snacks every day. And so the ways that their food, the ways that they could shop for food had really changed, because most of the moms in our project would shop for food one time a month when SNAP benefits were loaded. And then they would do kind of like little shops throughout the rest of the month. But during COVID, with food shortages, and especially in 2020, like they couldn't shop that way anymore. And so it was a very stressful time. And so they talked about how even though they had this kind of additional financial buffer, the mental and emotional load of like the shopping piece on top of that and budgeting, with also not having enough, still not having enough food, that lots of mothers said, you know, well, I'm making sure the kids are fed first. I'm making sure the kids are fed first, which again was a consistent thing over the years. So as Beatrice, Black grandmother, to put it during the pandemic, quote, only the strong will survive. And so in conclusion, I want to talk a little bit about some of the things that are particularly kind of striking to me in looking at this data, and I'm still working on it. So I'd appreciate any thoughts or feedback that you all have as I'm kind of working through this, is how central being a mother and a grandmother is to how they were interpreting these particular food policies. Like they were thinking about them in terms of their impacts on their children, and kind of being a mother and a caregiver was that kind of primary, was one of the primary lenses. And this is so contrary to the ways that mothers and caregivers are really left out of these conversations about food policy. We know that families are important kind of transmitters of civic skills, of political life across generations, and yet we're not really engaging the people whose lives are at the heart and center of our food policy debates in particular. So that's the first thing that I'm thinking about, is like that we need to center these voices and think about what they're saying as we think about potential changes to food policy or how to better support people who are food insecure. And so the recommendations that come from the mothers in our project would speak to, you know, thinking about food as a right, thinking about food is something that you shouldn't have to beg for, something that people, that mothers shouldn't have to go without and sacrifice their own health so that their children can be fed. Additionally, thinking about, I've been reading and thinking a lot about concepts of universal design and how they could relate to food access and food insecurity. There have been so many studies about the emotional distress, anxiety, depression, all of that people who are food insecure feel and face because of these experiences of stigma, sadness, and shame. And the mothers in this and the grandmothers in this project wanted elected officials to see that and to understand it, and hoped that they would make better decisions because they knew that. And so they recommended changes to policies that could alleviate those feelings or better mitigate those feelings of anxiety and distress. And those would be things like more flexible practices that supported working families rather than cutting them off for benefits right away. When you start to do they were like, I do all the right things, and then I get my SNAP benefits cut off. And additionally, mothers recommended greater ease of use in programs in order to promote human dignity and keep people from feeling like they had to beg. And kind of universal design can help with that, or could be harnessed to increase participation in things like SNAP and other federal food programs, clarifying eligibility, increasing accessibility. Things like the community eligibility provision increases participation for free school meals in high poverty areas, but almost 1 in 3 eligible schools are not taking advantage of the community eligibility provision, and rural schools are slower to adopt that as well. And so as we think about concepts of universal design and flexibility, we really need to understand and unpack these concepts of deservingness, and also look at how these concepts are not just they're not just things that the mothers and caregivers in our study are coming up with on their own. These are things that exist in our public consciousness, and they are shaping food policy. So from ideas of what a good mother is and the concepts of things like a welfare queen, these kinds of tropes, these racist, sexist, classist tropes, they're not only shaping like rural consciousness and how people are thinking about their own lives, they're shaping our food policy. They're shaping what politicians are saying and what they believe about families who are food insecure, rather than listening to the actual families who are food insecure. And then addressing this deservingness, like the flip sides of deservingness, and how that not only shapes food policy and creates what I would call a stingy system where we are not thinking about it from a rights-based perspective, but it also shapes like those feelings of stigma and shame that people who are food insecure face, because they don't feel like they're bad off, or there are others who are worse off than them. So like the deservingness kind of works both ways. And there's been a lot of research about this in particular in rural communities, and that kind of like bootstrap mentality of we have to do it ourselves, we have to take care of ourselves. The government doesn't care about us, they have left. We've got to take care of us, take care of our own communities. And so you see that kind of rural consciousness playing out in this data too, but in, kind of complicated ways. And I would say, finally, as we're doing this kind of work, it's hard to engage rural communities for lots of reasons. It's hard to engage caregivers in this work for lots of reasons, but we have to. And I think principles of intersectional praxis in public health, where we're thinking about meaningful community participation, addressing issues of power in research, looking at the complexities of social problems as they exist, and really thinking about these real world implications of the research and work that we do is critical. And so that's where I will end my talk. And thank you all for being here.
Thank you, Annie. Do you want to entertain questions either on Zoom or,
I'd be happy to.
yeah, or?
There's nothing on Zoom. Claudia claps.
Thank you.
I had a question.
Yeah.
You described in a powerful way to me what we hear often talked about a kind of breakdown of trust of institutions and authority, this kind of skepticism or even outright mistrust of government and of politicians. Two questions in regard to that. One, did that transcend down to the local level, like to the mayor or to your agricultural extension agents, or were they different? And two, did you see it playing out in terms of trust in religion, or did religion play out differently?
Let me take the religion one first. And I would say, I'm going to look at this like over the course of the whole study. So in general, most caregivers who are part of our project had pretty high trust in the religious institutions in their communities. When we did the asset mapping workshops and also in conversations with them, religious organizations were some of the key kind of resources and assets in their community, because they were, whether it was like, they had a food pantry that was able to support them. There was one church in one of the rural communities that we just heard about over and over and over again, because they had one of those giant gyms. And as you could, but with that giant gym, they did something different from what I think other churches with giant gyms do. They had Zumba classes, free Zumba classes for people in the community. Some of the classes, eventually, we became friends with the woman who was leading she got one of the mini grants over several years. She eventually in later years had to charge $1 for people to come to Zumba. They had childcare during the Zumba classes, and they also had like a track, and they had a weight room that people could use in the community for free. And so when we just heard over and over and over again from participants, we talked about things like, well, where do your kids go to be active? It was like, well, we go to this church because I can go and work out, the kids can play. And so there was a lot of trust. on the flip side of that, there was also people who felt like when they were accessing a food pantry in particular, they didn't want to feel like they were being evangelized or like they had to believe a certain thing to go to a food pantry. And so there were people who said, I don't feel comfortable going. And so there was like more trust in the religious institutions, but also a significant chunk of moms who said, no, absolutely not. I don't feel comfortable. On the local, state, and federal government side, it really varied. And we asked this particularly in 2020, like we asked a breakdown. In 2016, because it was such a fraught political moment, the way that we phrased the question about elected officials was, if you were talking to an elected official, we just said an elected official, what would you want them to know about your life and things that would be helpful? And then we kind of like probed from there. And in 2020, we asked about, what do you feel about this, your local government's response, the state government's response, and the federal government's response to COVID? So we kind of broke them down. And at all three levels, what was interesting, and like I didn't talk about it in this, people felt like they were not doing enough across the board. And so at a local level, you had mothers who were talking about being really frustrated by how local officials were not implementing state mandates around, or state requirements around masking and things like that. And then at the federal level, some of the things that were interesting is there were people who felt like they didn't shut down enough. Like we should have just shut things down. Like there were several quotes like this. It was like, why didn't we just shut things down for a month and just address this? And they felt like the federal government didn't do that. It also broke down on a federal government and a state government line. Again, it was an election year by who people had voted for and how they felt about the party. So for example, there was one mother, Clarissa, who I talk about here, and she's kind of emblematic of this. So she talks about how like President Trump was just doing the best that he could. He was doing the best that he could, but she felt like Governor Cooper was not doing enough to shut things down and to protect people. So it was very complicated, because I would have thought that she would have said, well, I can't believe Governor Cooper has shut everything down and that we have, our kids are still out of school, because we were kind of a more restrictive state in North Carolina. But she felt like he wasn't doing enough and that President Trump was doing. So you saw in that year, like a balance of who they voted for versus who they thought was doing a better job. So, and then in terms of local officials, I think people, and this comes out in like the rural consciousness and some of the rural politics literature, like people in general know their county or like municipal folks. And so there was more higher trust in those institutions, while also saying like, well, I wish they would have implemented this, or I wish they would have done this, but like feeling like their local governments were doing the best they could. So yeah, it's really complicated.
Interesting.
Yeah.
This is always a difficult question, so you can say, I have no idea, but any ideas as to what all of these findings might be, what the implications of them might be for the 2024 election?
I have no idea.
Just wonder.
Yeah, I don't know. I don't know.
We're still in a fraught political moment.
We're still in a fraught political moment. Yeah. I don't.
Thank you, Annie. That was great.
There was a chat, but.
Oh, she was just saying
Oh.
fantastic. Fantastic.
Thank you. Thank you. Great. Thank you, everyone.
Thanks, Annie.
Thank you all.